The programme of work that we've been building here in the centre is particularly around the urban environment and how that impacts on public health, particularly in terms of the prevention of non-communicable diseases, so things like heart disease, type 2 diabetes, some cancers, chronic respiratory disease and mental health. The project's called the PARC study, which stands for Physical Activity and the Regeneration of Connswater. It was an 8-year programme of work funded by the National Prevention Research Initiative, and that essentially was a public health evaluation of a new urban greenway that was built out in East Belfast. So the study took part from 2010 through to 2018, where we did a before and after evaluation looking really at the public health impact that this new £40 million greenway had on the local residents really. The project was led by Professor Frank Key here in the Centre for Public Health. It involved a number of researchers based in public health, but also various different disciplines and others across the university. So we had researchers with expertise in sociology and psychology and urban planning and mathematics. It had, I suppose, 4 main components. So we had a before and after household survey where we asked 1,200 residents, local residents, so those living within 1 mile of the greenway. We asked them various questions around their physical activity levels, their general health, their mental health. This was then repeated again with another sample of around 1,200 residents, about 6 months after the greenway had been developed. And then we had various discussions both with local residents but also with focus groups with local community groups as well, where we asked them what impact the greenway had on their lives really. And then the last element was an economic evaluation. 2 key findings I think from the research that I'd like to highlight. One's particularly in terms of the cost effectiveness of the greenway. So we did a modelling study a few years ago where we really looked at the cost effectiveness of the greenway improving the physical activity levels of local residents. We modelled if 2, 5 or 10% of the local residents went from not being or not really doing any physical activity to doing enough physical activity to meet the government recommendations for health. What impact would that have in terms of reduction in cases of chronic diseases such as heart disease, some cancers, type 2 diabetes? What that modelling study really showed us was that if as little as 2% of local residents changed from being inactive to being regularly active, then the greenway in a sense pays for itself. The other key finding that I'd like to highlight is particularly, it's another element of economic evaluation. So this was a social return on investment piece that we conducted. And here we look at the broader impacts of the greenway. So in particular we studied elements such as the impact of the greenway on tourism, on climate change, on housing prices, on employment and productivity. The research has also had an impact in terms of collaborations with the World Health Organization, and there I've been working with them in terms of producing guidance and action plans on urban green space interventions. And we've also had impact in terms of local policy. The work that we've done as part of the PARC study has also been embedded in the Northern Ireland Greenway strategy that the Department of Infrastructure have currently put together for future greenway investment across Northern Ireland.